Major organs that could be greatly affected by COVID-19? This is a must-watch. Can the coronavirus have long-term effects on your body? Can COVID-19 potentially cause any long-term damage to your organs? What are the most common long-term symptoms of COVID-19? Today, I'm going over all of that. You definitely are going to want to keep watching. Hey everyone, I'm Dr. Jordan Wagner. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. I've created this video series to help answer your questions and the questions I get from patients each and every day like you. Today, we're talking about the possible long-term effects of COVID-19 on the body. Listen, I know we're sick of hearing about it. Believe me, if anyone gets it, it's me. I'm an ER doctor and I deal with the deadly virus every day at the hospital. But I think what most people overlook about COVID is that sometimes the effects of COVID-19 can persist for months. It's called the morbidity of the virus, meaning even though you may be one of the lucky ones who does not pass away from the virus, not all patients who get COVID are recovering fully. A good majority of people who have COVID-19 recover completely within a few weeks, which is great. But some individuals, even those who had mild versions of COVID, continue to experience symptoms after their initial recovery. We call these people the long haulers. Scientists have classified this as a post-COVID-19 syndrome, meaning individuals are feeling unwell for weeks to months after infection. However, these lingering symptoms can actually be wreaking havoc on some of our body's most crucial organs. So which organs are at increased risk of long-term health problems? Number 1, the lungs. Many COVID-19 patients who have contracted the disease have developed life-threatening lung injury, also known as acute respiratory distress syndrome. Some individuals who have recovered from COVID-19 may experience scarring in their lungs from the aggressive respiratory virus. And what's worse is those lingering effects may not be completely reversible. Even individuals who overcome milder cases of COVID-19 may experience diminished lung function that could persist for a lifetime. In other words, things like decreased exercise capacity that leaves a person short of breath. Doctors out of Hong Kong have reported that COVID-19 survivors had 20 to 30% drop in lung function after recovery. In such cases, cardiopulmonary rehab may help in rebuilding strength and capacity of the lungs, although an individual's lung function may not return completely back to normal. Number 2, the heart. Patients with severe cases of COVID-19 can also develop inflammation of the heart muscle, also known as myocarditis. A study out of Renmin Hospital of Wuhan University reported that about 20% of patients with COVID-19 in China had heart damage during hospitalization. Another study discovered about 16% of patients developed an arrhythmia, or funny heart rhythm, or abnormal heart rhythm, while other reports indicated cases of acute onset of heart failure, heart attack, and cardiac arrest after a coronavirus infection. What is the reason why COVID can potentially affect the heart so much? Well, viral illnesses can destabilize plaque in the arteries, potentially resulting in a blockage and putting patients at risk of a heart attack, blood clots, or strokes. And unfortunately, sometimes these patients who experience heart conditions initially brought on by COVID don't fully recover by the time they're discharged from the hospital. Number 3 organ that could be potentially affected long-term by COVID, the kidneys. Kidney abnormalities have been seen in 25 to 50% of patients who develop the severe type of the disease, according to the International Society of Nephrology. When patients with severe COVID-19 go into intensive care, up to half have kidney failure that requires some form of dialysis. Dialysis is a treatment for kidney failure that rids your body of unwanted toxins, waste products, and excessive fluids by filtering your blood. When kidneys fail, your body may have difficulty cleaning your own blood and keeping your system chemically balanced. We often see these patients have more protein and red blood cells in their urine, and about 15% of them also develop a decline in filtration function. There are several theories as to why the coronavirus may be directly attacking the kidneys in severe cases. Perhaps it's a blood clot damaging them, or the kidneys aren't getting enough oxygen during the illness. Many researchers still have a lot of work to do to figure out why the kidneys can be so greatly affected by severe COVID-19. Number 4, the brain. When I see a patient discharged from the hospital after suffering from COVID-19, Oftentimes, patients struggle to think as clear as they did before they had the virus. Possible causes include not getting enough oxygen or blood to the brain, or the medications used to sedate them while being treated could be the culprit. A study published in Neurology Clinical Practice in December 2020 found that COVID-19 may lead to a number of neurologic complications. Researchers analyzed data from 921 adults at Boston Medical Center earlier last year. Of these, 74 had both tested positive for COVID and needed to be examined by a neurologist for complications, including strokes, seizures, and movement disorders. An additional study published found a high incidence of acute disseminated encephalomyelitis among COVID-19 patients. What this means is the condition damages white brain matter, which may lead to possible vision loss, weakness to the point of paralysis, chronic fatigue syndrome, and difficulty coordinating muscle movements. Other coronaviruses that affect humans can invade the central nervous system as well, so it makes sense that COVID-19 may possibly have neurologic manifestations as well. It is important to remember that most people who have had COVID-19 recover quickly, but is not the case for every single patient out there. Much is still unknown about how COVID-19 will affect individuals over time. The potential long-lasting problems from COVID-19 make it even more important to reduce the spread of the disease by following precautions such as wearing masks, avoiding crowds, and keeping hands clean. Alright, that's been a quick COVID breakdown with me, Dr. Wagner. Have you contracted COVID-19 and recovered? Do you have any lingering side effects or new onset health concerns from the disease? Comment below. I'd love to hear from you, and are there any other COVID-19 topics that you'd like to see me make a video about? Please leave me a comment below. And make sure you subscribe and turn your bell notifications on. When you do that and hit the like button, you let YouTube know that you'd like to see more videos like this one. Alright, thank you so much for watching, and stay healthy, my friends.